Hi, I'm Steve Willard with DGO Global. I'm here today to show you guys how to use the hip brace that Dr. Ellman will have you guys wear post-operatively. So we're going to get after it. So the brace will come shipped in a box. I do these at your house, so I'll be coming to your home and I'll make an arrangement to come see you the day before. I'll call you and we'll set up an appointment for that. First thing I do when I come to a patient's house, I'm just going to take a measurement of the waist so I can trim it to size. So we're going to fit this for a left hip today. It can be a right, and at the end of this video I'm going to show you how to flip it over and make it a right. So it comes universal, meaning it will one size fits all, so I need to trim it to size and make sure we get it, as comfortable as we can for the patient. So I'm just going to use my scissors here and cut it down to size so that it'll fit the patient. Typically you're going to be in this somewhere between 3 and 6 weeks. The amount of time that you're in it depends on Dr. Ellman and what he does surgically. Obviously, the more he does, the longer you'll be in it. The less he does, the quicker you'll get out of it. The amount of time you're in it will be totally dictated by Dr. Ellman. So these strings are going to help draw this thing around, kind of make it more snug on their waist, so they have the ability to make it tighter or looser. Sometimes in surgeries, you get a little bloated, so the brace needs to be bigger and then you need it tighter. So our brace has got the ability to be tightened or loosened as the patient needs for comfort. So this is just going to go around the patient's waist. This goes in the small of their back. I have them grab that. Go ahead and grab that. You're going to fold the left side and then the right side. So just like that. And then I'm going to hand the strings to you, one for your left hand, one for your right. If you just gently pull those, it's going to cinch it down to where it gets comfortable. There's no real rule there, just whatever feels comfortable for the patient. That's not the brace, this is actually the brace. That's just going to hold the brace around the patient's waist. So let's talk a little bit while I get this next part put together. Let's talk about how some of the rules of the brace. I mentioned how long you'll be in it, but let's talk about the rules. The rule on this brace is the following. You're going to be in this brace just when you're on your feet, but always when you're on your feet. So let's talk about what that means. Just when you're on your feet means you don't have to sleep in it, you don't have to wear it in a car, you don't have to wear it laying around watching TV. The CPM machine that you're learning about, you don't wear it when you're in the CPM machine. Really, anytime you're not on your feet, you don't have to wear it. I would say that, but the exception to that would be on the way home from hospital first day. I would leave it on because somebody is going to have to help you get it on when you get home. And it's always a little awkward because you're drowsy and anesthesia. So the first trip home from the hospital in the car, leave it on. After that, you don't need to wear it in the car. So I'm just setting the range of motion now. The motion settings that Dr. Ellman wants me to put you in is 0 to 90. So 0 is the way I'm standing. This is 90 degrees of hip flexion. That's the motion that the brace is going to allow during your recovery. So I just use this Allen wrench and tighten it down so that it locks that range of motion in from 0 to 90. And then this is just going to go on the waist belt. So I'm just going to remove this for a minute just so I can get this on the belt. You don't need to worry about this. The patient does not have to adjust any of this. Once I get this all set up, it stays the same for the entire time he has the brace on. There's really only about 3 things I've seen go wrong with these braces. People pull the string too aggressively and they pop the string. If that happens, it's just a simple knot, you can retie it. Second thing that can go wrong with the brace, if you turn here, there's these fittings, and sometimes one of these fittings can come loose. The bigger Allen wrench, which stays in the kit that I'll leave behind with you, tightens down these fittings, so you can just use that to tighten the brace back down. And then lastly, there is a little pad on this hip paddle, but it can sometimes dig into your hip over time, and if that happens and it's uncomfortable, I just tell you to take a hand towel, double it up, stick it down inside the waist belt to just give it a little extra cushion so that it's not too uncomfortable. The next thing I'm going to do is I'm going to sort of just form this to the contours of your leg. So I'm gonna let this go down so that we make this kind of match your anatomy. And then the longer the better. I don't want it to affect your knee motion, but I want to get this as long as I can get it so that we can help control that motion at your hip. And then this is just going to go around your leg like this. And then I just put this little cover over here because you see how it juts out a little bit. And when you're using your crutches, it can sometimes, your hand can hit this, and we don't want that to happen. And if it does happen, we've got this little pad here so that it doesn't dig into your hand or cause a problem. Always when you're on your feet means basically if you need to use your crutches to get from where you are to where you want to go or need to go, the brace needs to go on. You can, in a minute I'm going to have him take it off and put it back on. It takes 5 seconds to put on. That includes going to the bathroom in the middle of the night, letting your dog out for, or getting a glass of water, anything like that. The brace needs to go back on. The one exception to that is you don't shower in the brace. Otherwise it wouldn't be wearable after that. I encourage you to put something in your shower so you can sit down to shower, whether that be a stool, a lawn chair, anything that you don't mind getting wet. It's gonna be way easier to shower sitting down than trying to balance on one foot. And so it's important to talk about that. Crutch-wise, we're gonna have a crutch fitting part of this video and they'll go into some details there, but I wanna make sure that you're comfortable with the crutches and the brace together. So the next thing I want to talk about is why does Dr. Ellman have you wear a brace? It really helps with patient compliance to know why they're wearing something. If they understand that, then it's, the compliance goes way up. There's several reasons. The first reason is Dr. Ellman trained with a group that developed most of the techniques that he uses. That group also developed a post-op rehab protocol that included a brace. And so the outcomes in that clinic were excellent. Dr. Ellman's outcomes are excellent. The brace isn't the only reason for that, but it's a part of the reason that the outcomes are so good in Dr. Ellman's clinic. Second reason to wear a brace is to remind you that you've had surgery. You're not going to need a ton of remind in the first few days, but you're going to get better fairly quickly. And we just want the brace to remind you, slow your roll, let your hip heal so that we don't have to have this surgery done again. Third reason to wear a brace is to remind those around you, friends, family, people at the grocery store. If you're a student, when you're in school, to and from class, in a classroom, that people notice the brace and leave you alone essentially and don't bang into you. And then the last reason is the range of motion component of the brace and what it helps to limit. And I'm going to show you that here in just one moment. I'm going to first have him come out of the brace and then it's easier to show the motion with the brace off. So go ahead to come out of the brace. I like to have you come here first and just find the back, and you're going to pull that and release off there, and then you can do what you did, just release these two to get the tension off, grab the belt there, and you're out. It's that quick, just the opposite to put it back on. So we talked about the range of motion being from 0 to 90 degrees of hip flexion. When you look at the brace, 0 to 90 degrees of hip flexion, that's the range of motion that it will allow. That's also the exact same range of motion that's set up in your CPM machine, so we're staying consistent. The reason why that motion is chose is anything past that. So way up in here and way back in here and way out in there are all motions that can jeopardize your repair. And we want to prevent anything going wrong. And so the brace is an adjunct to just help keep you in that safe range of motion. The brace as you're looking right now is set up as for a left hip. I'm going to show you how to turn it around and make it a right. First thing you're going to do is you're going to take off the protective cover. You're going to grab the smaller of the two Allen wrenches, and right on the top of the range of motion dial, there's a little spot that hinge or that Allen wrench fits into. You're just going to loosen that by turning it counterclockwise until it comes all the way to the top. Now, if you look down here on the bottom, you will remember that we had the range of motion stops set on the white or gray portion of the range of motion dial for the left hip. We're going to flip those around and make it the same thing, 0 to 90 in the black portion of the range of motion dial. Once you get that set, then you just need to tighten it back down so it locks that motion again for that right side. Just like that, okay? Next thing you need to do is we need to flip the bottom of the brace. So you'll remember when you were wearing it for your left side, the plastic piece was on your thigh. If I don't switch it around, it's gonna be on your hamstring, and we want it to be on your thigh. So the bigger Allen wrench is used on the very distal or the last Allen wrench screw on the brace. I'm just going to take that out. And then if you look on the back side, you can see there's the little washer piece on the back, or the little nut right there. So what we want to do now is take this off, flip it all the way around, and put it right back on the spot that we had it on originally. And you're going to feed that washer or nut back through like that. Put the screw back in. We're almost done. We just have one thing left to do, and that's to just move the brace from the left side of the waist belt to the right. So I just like to make sure that you put this around as if it was still from the previous surgery, so you can sort of orientate yourself where this sits on the belt on one side. You're going to just take that off. We're going to move it over to the other side of the belt. Just like that. Now we're ready to put it on the other side, and you've got a right brace.